6:14 a.m., January 9th, 2026. Torrance County, New Mexico. 34 federal agents moved through frozen scrubland before sunrise. No sirens, no lights. 3 vehicles peeled off to cover the eastern fence line. 2 more blocked the only road out. The rest. A mix of HSI tactical units and FBI field agents out of Albuquerque. Stopped 200 meters from a property line marked with a rusted cattle gate and a hand-painted no trespassing sign. Inside the compound, 9 children. 9 kids between the ages of 4 and 13, each documented in federal Medicaid files under identities that didn't belong to them. Each brought across the Arizona border, each waiting. The trafficking network's fraudulent Medicaid billing operation had processed an estimated $2, $3 million in claims. The real cost of what was happening inside that compound had no dollar amount. This is the story of how a single spreadsheet discrepancy, flagged by a billing administrator nobody in federal law enforcement had heard of, unraveled 22 months of organized child trafficking across 2 states. It started with a number that shouldn't have existed. Not a tip, not an informant, not a wiretap or a years-long undercover operation. It started with a woman named Rosa Delgado sitting at a desk in a community health clinic in Albuquerque, running a Medicaid reimbursement batch file on a Tuesday morning in November 2025. Delgado had worked in medical billing for 11 years. She'd processed tens of thousands of patient records across 3 different clinic systems. She understood the rhythms of Medicaid data the way a musician understands time signatures, which meant she knew, immediately, when something was off. The clinic she worked for, Puente de Salud Community Health Center, served a largely low-income population in Albuquerque's South Valley neighborhood. It was a federally qualified health center, receiving federal matching funds and operating under HHS oversight. Routine work, routine audits, routine data. The batch file Delgado was running on November 18th, 2025 was not routine. She was processing pediatric patient records, intake forms, Medicaid enrollment data, visit histories. 9 files in total, all registered within a 6-week window between September and late October 2025. That alone was unremarkable. New pediatric patients came in clusters all the time. School enrollment periods, seasonal flu, families arriving in a neighborhood together. What was not unremarkable, all 9 records listed the same emergency contact phone number, one number. 9 separate families, 9 separate addresses, 9 separate insurance enrollment dates. Delgado flagged it internally and brought it to her supervisor, Clinic Operations Manager Patricia Garza. Garza reviewed the files and told Delgado it was almost certainly a data entry error. The clinic used third-party intake software with a history of autofilling fields incorrectly. This kind of thing happened. It would be corrected in the next audit cycle. Move on. Delgado did not move on. She pulled the 9 files manually and spent 2 evenings of her own time cross-referencing them against the Medicaid enrollment portal. That's when she found the second anomaly. 3 of the 9 children shared Social Security numbers with minor variations. Not identical, varied. A digit transposed here, a digit incremented there. The kind of variation that slips past automated systems looking for exact duplicates, but jumps out immediately to someone who has spent a decade staring at patient identification fields. SSN overlap in medical records has a known baseline rate. In a legitimately operated clinic system, accidental SSN duplication or near duplication across unrelated patients occurs at roughly 1 in 40,000 entries. Delgado was looking at 3 instances across 9 records. That was not a data entry error. That was a pattern. She filed a complaint with the Department of Health and Human Services Office of Inspector General on November 21st, 2025. She submitted the 9 patient file numbers, the shared emergency contact phone number, the 3 near duplicate SSNs, and a brief written summary of her findings. She used the OIG's online fraud reporting portal. She didn't tell her supervisor she had done this. The complaint sat in an intake queue for 4 days. On November 25th, it was routed to HHS OIG Senior Investigator Christine Polk, based in Dallas. Polk had spent the previous 6 years working Medicaid fraud cases, most of them billing mills and phantom provider schemes. Child-focused cases were rarer in her caseload, but the SSN pattern in Delgado's complaint matched something she'd seen flagged in an HSI intelligence brief 3 months earlier. A note about a suspected child identity theft operation running across the Arizona-New Mexico border corridor. She picked up the phone and called the HSI field office in Albuquerque. The investigation that followed ran for 45 days. It pulled in 2 FBI field offices, an HHS OIG forensic accounting team, the New Mexico Children, Youth and Families Department, and eventually a federal grand jury. It ended with a tactical raid on a rural compound at dawn. 9 children recovered, and a licensed social worker arrested at the Chihuahua border, crossing with $34,000 in cash and falsified adoption paperwork in a blue nylon bag. But before any of that, investigators first had to understand what they were actually looking at. The SSNs Delgado had flagged did not belong to living children. This is the detail that stayed with me going through the case documentation. Not the scale of the operation, not the money. This one specific thing. The Social Security numbers used to build identities for these 9 children had been harvested from the records of deceased minors. Children who had died in infancy or early childhood, mostly in the late 2000s and early 2010s. Their SSNs had been dormant in federal databases for years, long enough that automated verification systems would return a low-risk flag rather than an alert. Whoever built this system knew exactly how SSN verification worked. They knew the gap between death record processing and SSN database flagging. They knew which SSNs would pass a Medicaid enrollment check and which would trigger a human review. This was not improvised. It was engineered. The 9 children in those records had been brought across the Arizona border, according to subsequent investigation, over roughly 5 months. Their actual identities, real names, real countries of origin, were unknown when HSI opened the case. Their constructed identities gave them ages ranging from 4 to 13, medical histories carefully populated with routine pediatric visit records, vaccination logs, and school enrollment documentation. The medical histories were the critical piece. Investigators later determined that the traffickers needed them specifically to support placements with buyers posing as foster families. A child without a documented medical history raised questions during foster placement processes. A child with a complete file. Immunization records, growth charts, primary care visit notes moved through the system with far less friction. The Medicaid registrations were not incidental to the operation. They were the mechanism. What do you think? Did the federal Medicaid verification system fail these children? Or was this gap inevitable given the scale of the system? Drop your answer in the comments. We read every one. HSI Special Agent Dario Salazar was assigned as lead investigator on December 1st, 2025. He was 41 years old and had spent the previous 4 years working cross-border human trafficking cases out of the Albuquerque field office. He reviewed Delgado's original complaint file in under 2 hours, then spent the rest of that day on the phone. The emergency contact number on all 9 Medicaid records traced to a prepaid phone purchased in Tucson, Arizona. The phone had been active for about 7 weeks and had made or received fewer than 30 calls, all to or from a small cluster of numbers in the 505 area code. None of those numbers resolved to registered businesses. Most traced to additional prepaid devices. The phone network itself told a story. Tight. Compartmentalized. Each number touching only 1 or 2 others. No overlap. No centralized hub. It was the architecture of a system designed specifically to prevent a single point of failure from bringing down the whole structure. Salazar requested a full subscriber and call data records pull through legal process. While that was being processed, the HHS OIG forensic accounting team, 3 people out of the Dallas regional office, began pulling Medicaid enrollment and billing records for all 9 patient files. What they found extended the timeline significantly. The 9 children in Delgado's batch file were not the beginning. They were the most recent batch. Going back through New Mexico Medicaid enrollment records and cross-referencing against the phone numbers and SSN patterns from Delgado's complaint, the forensic accounting team identified 2 earlier groups. A first cohort of 4 children enrolled in early 2024, and a second cohort of 7 children enrolled in late 2024. 13 additional children, enrolled through the same mechanism, their identities constructed through the same SSN harvesting technique. 22 children total, across 22 months of operation. By late December 2025, when investigators had assembled this picture, the question was no longer what had happened. It was where the 9 most recent children were right now. The answer came from a surveillance operation that had been running quietly for 2 weeks. The prepaid phone network led investigators to a property in Torrance County, roughly 60 miles southeast of Albuquerque. The property was registered to a limited liability company incorporated in Nevada with a registered agent in Scottsdale. The LLC had been formed in January 2024, 3 months before the first cohort of children appeared in the Medicaid system. County assessor records described the property as a working cattle operation. Satellite imagery from late November 2025 showed several structures: a main residence, 2 outbuildings, and what appeared to be a newer prefabricated structure added to the eastern portion of the property sometime in the past 18 months. Thermal imaging conducted during aerial surveillance in late December detected heat signatures consistent with multiple individuals in the prefabricated structure. Some of those signatures were small. This is where the investigation hit its first serious obstacle. Investigators needed to confirm children were present on the property before they could move toward a warrant. Thermal imaging alone wasn't enough. They needed human intelligence, someone who could put eyes on the compound without alerting whoever was running it. The problem: the property sat on a road with no legitimate foot traffic, surrounded on 3 sides by open scrubland and a working ranch to the north. Placing any kind of fixed surveillance in the immediate area without alerting the occupants was, in Salazar's estimation, close to impossible. They found a solution through the New Mexico Children, Youth, and Families Department, a state child welfare worker. One of a small number of officials brought in on a need-to-know basis. Conducted what was framed as a routine follow-up visit to the property on December 29, 2025. The cover: a state welfare check triggered by a flagged gap in school enrollment records for one of the children from the first cohort, now 2 years old in the system. The welfare worker was met at the gate by a man who identified himself as the property manager and declined to allow entry without advance scheduling. He was polite. He produced documentation quickly: copies of enrollment records, a letter from a licensed social worker. Everything appeared in order. But the welfare worker noted something during the interaction that she reported back to investigators that afternoon. The man at the gate was wearing a lanyard from a licensed child placement agency based in Santa Fe. He had no reason to be wearing it. It wasn't his identification. It wasn't something a property manager would carry. It was the kind of thing that accumulates on a person who spends a lot of time navigating official systems. Something you forget you're wearing because you've been wearing it so long it stops registering. Investigators pulled the agency. The license was real. The agency, a small private foster placement nonprofit called Camino Abierto Child Services, had been operating in New Mexico for 8 years with no significant violations on record. Its executive director, a licensed clinical social worker named Gerald Mars, 53 years old, certified by the New Mexico Regulation and Licensing Department, 11 years of clean state certification. Salazar ran Mars's name through every available database that evening. No criminal record, no financial red flags in public records, no civil litigation beyond a routine contract dispute from 2019. Nothing. He called his supervising agent at 11:30 that night. "I've got a clean license, a clean record, and a lanyard at a compound in the middle of the desert. I don't have enough for a warrant." They needed more. Most people assume federal investigations move in straight lines. A lead appears, agents follow it, a warrant gets signed. The evidence tells a different story. What actually happened over the next 10 days was slower, more methodical, and several times came close to falling apart entirely. The court-authorized intercepts on the prepaid phone network went active on January 2nd, 2026. For the first 5 days, they produced almost nothing useful. The phones were being used sparingly. Conversations were brief and elliptical. References to scheduling, documentation, timelines. Nothing explicit. Nothing that would survive a suppression challenge in court. On January 7th, that changed. A call came in on one of the monitored numbers at 8:47 p.m., 11 minutes long. The caller, speaking in a mix of English and Spanish, discussed a specific document, described only as the package and a travel window. The word Chihuahua appeared twice. A date was mentioned, January 12th. Investigators had 5 days. Salazar convened a joint briefing with HSI Tactical, FBI Albuquerque, and the HHS OIG team on January 8th. The warrant application had been in progress for 2 weeks. It was ready. A federal magistrate judge reviewed and signed it the same evening. The operation was scheduled for 6 a.m. on January 9th. Then, at 10:30 p.m. on January 8th, 8 hours before the raid, the lead tactical coordinator discovered that the floor plans they'd been working from were drawn from a 2017 county building permit application. The prefabricated eastern structure, added sometime in 2024, didn't appear on any filed permit. They had no structural data on it, no dimensions, no interior layout, no indication of how many rooms it contained or how they were configured. The tactical team had 2 hours to adapt. They pulled commercial satellite imagery from 3 different providers and used it to estimate the structure's footprint. A building contractor with federal clearance was reached by phone at midnight and walked them through likely interior configurations based on the structure type and size. By 2 a.m., they had a working tactical plan built on estimated data rather than verified blueprints. It was not ideal. Salazar later described it in his after-action report as an acceptable risk calculation given the time constraint and the welfare of the individuals believed to be present on site. At 5:30 a.m. on January 9th, the convoy assembled on a county road 4 miles from the property. 6:14 a.m., January 9th, 2026, Torrance County, New Mexico. 34 agents moved through frozen scrubland before sunrise. The tactical entry team, 12 HSI agents in full tactical gear, approached the main gate on foot while 2 vehicles held position on the road. 4 more agents positioned themselves at the eastern fence line to cover the prefabricated structure. The remaining personnel held a perimeter far enough out to contain any vehicle attempting to leave. The gate was secured with a chain and padlock. It took 11 seconds to breach. The property manager, the same man who had met the welfare worker at the gate 10 days earlier, emerged from the main residence at the sound of the breach. He was told to get on the ground. He complied immediately. He was cuffed and moved to a holding position near the driveway. 2 agents cleared the main residence. 4 adults present, 2 men, 2 women. All were detained without incident. The prefabricated eastern structure was locked from the outside. The entry team breached the door at 6:22 a.m. Inside, 9 children. The youngest was 4 years old. The oldest was 13. All 9 were present. All 9 were alive. The structure had 4 rooms, 2 sleeping areas with multiple cots, a bathroom, and a small common area with a folding table and 2 chairs. The children were dressed in matching clothing. Each of them had a folder of documents sitting on the cot near them: laminated ID cards, vaccination records, Medicaid enrollment printouts, organized, labeled, ready. The folders were the operation in miniature. Everything a buyer posing as a foster family would need to process a child through a placement system: medical history, identity documentation, a clean paper trail manufactured from scratch using stolen SSNs and fraudulent clinic visits. Investigators had pulled the thread. Delgado handed them and found this. One detail that stayed with me, going through the post-raid documentation: each folder had a handwritten note inside it, a first name. The constructed name, not whatever name each child had originally been given, written in the same hand, in blue ink, as though labeling items in a storage system. 9 notes. 9 names that didn't belong to anyone. Gerald Mars was not on the property when agents arrived. HSI had flagged him as a flight risk in the warrant application and had requested a simultaneous parallel operation targeting him directly. The FBI team assigned to that operation had been watching his Santa Fe residence since 5 a.m. He wasn't there. His vehicle was gone. At 7:11 a.m., 49 minutes after the compound raid began, a call came into the HSI Tactical Coordination Channel. Mares had been spotted by CBP agents at the Santa Teresa, New Mexico port of entry, attempting to cross into Chihuahua. He was driving a rented SUV. He had a blue nylon bag in the back seat containing $34,000 in cash, 3 sets of falsified adoption documents, and a Mexican national ID in a name other than his own. He was arrested at 7:14 a.m. He said nothing at the time of arrest. He was transported to the Doña Ana County Detention Center and processed. His attorney filed a notice of representation within 6 hours. The post-arrest investigation took 3 additional months. The HHS-OIG forensic accounting team traced the $2. $3 million in fraudulent Medicaid billing across 4 different clinic systems in 2 states, New Mexico and Arizona, with Camino Abierto functioning as the administrative conduit between children and fake placements. The SSNs came from a database compiled, investigators determined, from funeral home records and state vital statistics filings in 3 southwestern states. Someone had spent considerable time building that database. That person has not been identified. Here's the take that will probably get some pushback. Gerald Mares was not a lone actor who happened to exploit a gap in the system. He was a product of the gap. 11 years of clean certification, 0 flags. An agency that operated under state oversight for nearly a decade. The system validated him repeatedly at every renewal cycle and never had a mechanism for detecting what he was actually doing with his license. That's not an individual failure. That's a structural one. The New Mexico Regulation and Licensing Department had no cross-referencing protocol between licensee files and Medicaid fraud databases. It still didn't, as of the date of Mars' arrest. The question investigators were quietly asking, and that should probably be asked loudly, was how many other licensed social workers and placement agencies were operating in the same space without any monitoring bridge between their licensure status and federal fraud detection systems. Looking back at this case, the real question isn't whether Mayers will be convicted. It's whether the conditions that made him possible have actually changed. Following the raid, all 9 children were placed into the custody of the New Mexico Children, Youth, and Families Department. They were transported to a state facility in Albuquerque, where medical staff and trauma specialists were waiting. 3 of the 9 could not communicate in English. 2 were unable to provide any reliable information about their actual names or countries of origin during initial interviews. As of the case, documentation reviewed, 2 of the 22 children identified across the full operations timeline, from the first cohort enrolled in early 2024, have not been located. Their constructed Medicaid identities were real enough to process claims. Their actual whereabouts, under their actual identities, remain unknown. Put yourself in Salazar's position. You've recovered 9 children and, there were 22. You have 13 more accounted for through earlier placements. Some traced, some still being traced through buyer networks stretching across 4 states. And 2 of them, somewhere, are still out there with identities that don't belong to them and a paper trail designed to make them invisible. The HHS Office of Inspector General issued a formal notification to Congress on February 14, 2026, documenting the vulnerability in Medicaid's identity verification system that the operation had exploited. The notification identified 3 specific gaps: the absence of real-time cross-referencing between SSN enrollment data and the Social Security Administration's Death Master file for pediatric records, the lack of automated flagging for clustered emergency contact duplication across unrelated patient files, and insufficient audit triggers for new pediatric Medicaid enrollments in geographic areas with low historical enrollment rates. HHS moved to patch all 3 gaps within 60 days of the arrests. The patches are administrative. They apply new rules to new enrollments. They do not retroactively audit the existing system. Gerald Mares faces federal charges, including conspiracy to commit human trafficking, Medicaid fraud, identity theft, and use of fraudulent documents. The property manager and the 4 individuals detained at the compound face related conspiracy charges. 3 additional individuals, identified through phone, intercept data, and subsequent financial investigation, were arrested in Arizona in February 2026. 2 more are believed to have left the country. Their status remains open. The SSN database that supplied the harvested identities for all 22 children has not been seized. Investigators traced its origins to a server cluster that passed through at least 4 different hosting jurisdictions before going dark in late January 2026. Whoever built it and whoever else may have had access to it, that thread is still open. Will this network's methods appear again in a different form, in a different state, before the federal verification patches are fully implemented? Comment YES or no. Rosa Delgado was interviewed by HHS OIG investigators in December 2025 during the early phase of the investigation. She answered every question. She provided every internal document she had access to. She explained her process in precise technical detail. She was not formally recognized in any public statement issued by HSI or the FBI following the January raids. Federal agencies rarely name private civilians in operational summaries. Her name appeared in a single line of the grand jury indictment as the originating complainant. She still works at Puente de Salud Community Health Center. She processes Medicaid reimbursement files. If you've ever done a job that felt purely administrative, clicking through spreadsheet rows, running batch files, reviewing fields that looked the same yesterday as they did today, you know what it feels like to reach the moment when something isn't the same. Most people scroll past it. They assume the system will catch it. They assume someone else already knows. Delgado didn't scroll past it. She pulled the file, cross-referenced it, and filed a complaint on a government portal most people don't know exists. 9 children were home, if home is even the right word for what came next for them, because of that. Subscribe so you don't miss the follow-up when the Mayers trial date is set. This case has more layers that still haven't made the news. What's most surprising about this case isn't the scale of the fraud or the sophistication of the document operation. It's the 11-year track record. 11 years of legitimate practice, real clients, real placements, real children helped through a real system. And then this. The forensic accounting team found no evidence of prior trafficking activity before 2024, which raises a question nobody has answered on the record. What changed? Was this always the plan? Or did something shift? That answer is not in the indictment. It may not come out at trial. There's a line in the federal grand jury filing that reads almost like something from a different kind of document. It describes the 9 folders found in the eastern structure, the ones with the children's constructed names written in blue ink, and notes that the handwriting across all 9 was consistent with a single author. That's it. No further analysis. No identification. One consistent hand, 9 names, and a notation that disappears into the procedural language around it. That detail doesn't sit right, even now. It implies someone who was present enough to label every child's file personally, not a manager reviewing from a distance. Someone who was there, who knew each child by their constructed name, who organized their documents with the same care you'd give a filing cabinet in a legitimate office. Whether that person is already in custody or is one of the 2 individuals believed to have left the country, the record does not say. The network operated for 22 months. The demand that created it still exists. The 2 unlocated children are somewhere. The spreadsheet found it. The system, eventually, responded. What came before the spreadsheet, and what exists parallel to it right now in systems that haven't yet produced their own Rosa Delgado? That question has no current answer.